1. What is the primary goal of the American College of Medical Practice Executives, ACMPE? A. To certify medical assistants. B. To advance the professional development of medical practice leaders. C. To accredit hospitals and healthcare facilities. D. To provide clinical education to physicians. 2. Which ACMPE credential demonstrates a mastery of medical practice management competencies? A Certified Medical Practice Executive, CMPE. B. Project Management Professional, PMP. C. Certified Public Accountant, CPA. D. Registered Nurse, RN. 3. ACE Body of Knowledge focuses on which primary domains? A. Leadership, Operations Management, and Healthcare Law. B. Finance, Human Resources, and Patient Care Delivery. C. Operations, Financial Management, Risk Management, and Governance. D. Health Informatics, Nursing, and Patient Communication. 4. Which leadership style best aligns with ACMP principles for effective medical practice management? Autocratic. B. Transformational. C'est laissez-faire. D. Micromanagement. 5. When evaluating staff performance in a medical practice, which method aligns with ACMPE recommended evaluation principles? A. Annual reviews based only on attendance. B. 360-degree feedback emphasizing measurable competencies. C. Informal peer evaluations. D. Random performance checks. 6. Which of the following best represents the concept of compliance in medical practice management? A. Following ethical and legal standards in healthcare operations. B. Maximizing profit margins regardless of regulations. C. Delegating all compliance duties to legal staff only. D. Ignoring minor violations to reduce costs. 7. What is a key component of mentoring under ACMPE professional development standards? A. Encouraging professional growth through structured feedback and modeling behavior. B. Providing social support without performance feedback. C. Assigning mentees to unrelated administrative roles. D. Limiting mentor-mentee interactions to once per year. 8. Which of the following is a core competency under the ACMP body of knowledge? A. Effective revenue cycle management. B. Performing clinical procedures. C. Administering medication safely. D. Conducting surgical training. 9. According to ACE standards, what is the first step in resolving a workplace conflict? A. Ignoring the issue until it escalates. B. Identifying the root cause through active listening. C. Assigning blame to one party. D. Transferring one employee immediately. 10. Which document is essential for maintaining regulatory compliance in healthcare organizations? A. Policy and Procedure Manual. B. Annual Report to Shareholders. C. Employee Attendance Log. D. Staff Birthday List. 11. What does Continuous Quality Improvement, CQI, emphasize under ACMPE guidelines? A. Ongoing process evaluation and data-driven decision-making. B. Annual performance reviews only. C. Compliance without innovation. One-time training sessions. 12. In medical practice management, benchmarking is used primarily to A. Compare performance metrics against industry standards. B. Eliminate low-performing employees. C. Increase revenue by reducing services. D. Avoid regulatory audits. 13. The role of communication in a healthcare leadership setting includes A. Fostering collaboration and transparency within the team. B. Limiting information flow to upper management only. C. Using only written memos for all communication. D. Avoiding feedback to reduce conflict. An effective performance appraisal system under ACMPE emphasizes A. Objective metrics aligned with organizational goals. B. Subjective opinions from peers only. C. Employee popularity in the workplace. D. Random feedback from supervisors. 15. What is the most effective adult learning strategy for professional staff development? A. Lecture-based instruction with minimal interaction. B. Experiential learning involving case studies and real scenarios. C. Passive observation of others without practice. D. Memorization of policy manuals only. 16. Which of the following is a key feature of servant leadership in healthcare administration? A. Prioritizing the needs of staff and patients before one's own. B. Focusing solely on organizational profits. C. Limiting employee input in decision-making. D. Directing from authority rather than collaboration. 17. What is the best evaluation method for measuring training effectiveness? A. Pre- and post-assessment comparison. B. Participant satisfaction survey only. C. Random interviews. D. Attendance tracking. 18. Under ACMPE ethics guidelines, conflicts of interest must be A. Disclosed and managed appropriately. B. Ignored if minimal. C. Kept private between staff. D. Handled by HR only. 19. A practice manager uses a SWOT analysis to A. Assess strengths, weaknesses, opportunities, and threats. B. Determine annual patient satisfaction scores. C. Audit financial performance exclusively. D. Develop clinical care plans. Which regulation primarily protects patient privacy? A. Health Insurance Portability and Accountability Act, HIPAA. B. Family and Medical Leave Act, FMLA. C. Occupational Safety and Health Administration, OSHA. D. Americans with Disabilities Act, ADA. 21. In effective mentoring relationships, feedback should be A. Constructive, timely, and behavior-focused. B. General and infrequent. C. Given only during annual reviews. D. Focused on personality traits. 22. What financial report provides insight into a practice's profitability? A. Income statement. B. Compliance audit. C. Equipment inventory list. D. Scheduling report. 23. What is the purpose of strategic planning in medical management? A. To align organizational objectives with long-term goals. B. To address daily scheduling only. C. To assign random duties. D. To focus solely on budget control. 24. Effective delegation in leadership involves A. Assigning tasks based on competence and trust. B. Delegating all decisions to subordinates. C. Avoiding delegation to retain control. D. Assigning random tasks without guidance. 25. Which of the following best supports employee retention in healthcare organizations? A. Career development and recognition programs. B. Strict disciplinary actions. C. Limited training opportunities. Annual pay freezes. 26. The ACMP promotes which type of leadership in healthcare organizations? A. Ethical and collaborative leadership. B. Autocratic management styles. C. Isolated decision-making. D. Minimal staff involvement. 27. A root cause analysis is used to A. Identify underlying factors in adverse events or errors. B. Assign blame to individual employees. C. Develop marketing strategies. D. Audit payroll data. 28. What is the first step in implementing a new policy? Communicating and training staff on its purpose. B. Enforcing it immediately without explanation. Posting it without context. Ignoring staff feedback. 29. Which law prohibits employment discrimination based on disability? A. Americans with Disabilities Act, ADA. B. Occupational Safety and Health Administration, OSHA. C. Health Insurance Portability and Accountability Act, HIPAA. D. Fair Labor Standards Assay. 30. A healthcare administrator demonstrates regulatory compliance by A. Regularly reviewing updated legal standards. B. Delegating all responsibility to one employee. C. Waiting for audit notices. D. Avoiding documentation. 31. What is the key purpose of time management in practice administration? A. Maximizing efficiency and productivity. B. Avoiding staff interaction. C. Reducing quality to meet deadlines. D. Micromanaging every task. 32. An effective team meeting should A. Encourage participation and focus on problem solving. B. Be dominated by the manager's opinions. C. Avoid discussion of challenges. D. Have no clear agenda. 33. What is the main purpose of a compliance audit? A. To ensure adherence to laws, regulations, and policies. B. To increase marketing visibility. C. To evaluate customer satisfaction only. D. To assess employee morale. 34. When managing change, leaders should A. Communicate the vision clearly and involve stakeholders. B. Announce changes without input. C. Withhold information to minimize anxiety. D. Focus only on senior staff concerns. 35. What is a key aspect of patient-centered care? A. Involving patients in decision-making about their care. B. Prioritizing administrative goals over patient needs. C. Reducing communication with patients. D. Limiting feedback from patients. 36. In adult education, self-directed learning is most effective when A. Learners identify their own goals and apply knowledge practically. B. Instructors dictate every learning objective. C. Feedback is delayed until the end of training. D. Learners memorize content only. 37. The most effective way to ensure accountability within a healthcare team is to A. Set measurable performance indicators and review them regularly. B. Avoid tracking outcomes. C. Delegate without expectations. D. Limit communication. 38. Which financial management tool assists in tracking cash flow and expenses? A. Budget variance report. B. Marketing plan. C. Staff roster. Strategic map.